Hello everyone, this is Jumana Librakit. Me and my colleagues will present our case 13 for course CPC622, which directed by Dr. Crystal Salman. Starting with case report, a 60 years old boy with a history of congenital heart disease reports to your clinic with a bilateral swelling of the mandible. The swelling is slow in growth and with no pain. After the fine needle aspiration cytology was taken and reveals multinucleated giant cells.
Good morning, everyone. This is Madal Khatani. I'm going to describe the case interpretation. The site and the location, it is bilateral, both maxilla and the mandible. The epicenter of the lesion are in the maxillary tuberosity and the mandibular of the ramus. The periphery well defined and corticated. The internal structure, fine granular bone with the wispy trabecular forming and ill-defined septa. The effect on surrounding structure, expansion of the cortical boundaries of the maxillary and the mandible, which cause teeth displacement in anterior direction.
Hello everyone, my name is Renat Hijazi and I'll be presenting the differential diagnosis. Our first differential is cherubism, which is a developmental abnormality, occurs between the ages of 2 and 6. It occurs posterior in the mandible, ramus, and tuberosity. It's bilateral and it's a painless enlargement of the lower face. It's also well defined and corticated. It's multilocular and has a fine granular pattern. There is also expansion of cortical boundaries of maxilla and mandible. Our second differential is central giant cell granuloma, which is a reactive lesion occurring under the age of 20 years old. It occurs anterior to the first molar in the mandible. It's painless and a slowly growing swelling. It has well-defined margins and no cortication. It's unilocular with wispy and ill-defined septa, and there is inferior displacement of the inferior dental canal. Our third differential is aneurysmal bone cyst, which is a reactive lesion occurring under the age of 30 years old. It occurs in the molar and ramus region in the mandible. It's multilocular and has wispy, ill-defined septa. There is expansion of outer cortical plates and displacement and resorption of involved teeth. Our last differential, which is fibrous dysplasia, it's a bone dysplasia. The monostatic type occurs in older age, whereas the polystatic type occurs under the age of 10 years. It occurs in the posterior maxilla and it's unilateral. It's ill-defined and there is a gradual blending from normal to abnormal trabecular bone pattern. There is involvement of the lateral wall of the maxillary sinus. It has a ground glass appearance and an orange peel pattern. Thank you for listening.
Hello, I'm Hadir Al-Khamsi and our definitive diagnosis is the cherubism. Cherubism, it's a disorder characterized by abnormal bone tissue in the jaw, starting in early childhood. Both the lower and upper jaws enlarged as bone is replaced by painless cyst-like growth. Always bilateral, multilocular cystic enlargement of the jaw can be seen in radiograph. The mandible's posterior body and ramus are the first sites of lesion, except the condyles, with dislocated, impacted, and floating teeth seem to be in the cyst-like spaces.
Hello, my name is Jawhar Al-Barakati. I will talk about the management. The management of cherubisms varies considerably and must be individually determined for each patient. It ranges from conservative management to more radical surgery. Conservative management is the preferred treatment as a cherubism has a self-limiting course. The policies of waiting for disease regenerations followed by the evaluation of physiologically bone remodeling is the most recommended. Treatment option: waiting for stabilization and spontaneous remission of the disease, tooth extraction in area showing fibrous alterations, cosmetic osteoplasty of the affected jaws after regeneration of disease activity, curettage of the lesion and treatment with collagenine in case of functional impairment. Anti-tumor necrosis factor alpha therapies are already in clinical practice for the treatment of rheumatic arthritis. Prosthetic treatment, radiation therapy because of the potential risk of the osteonecrosis or even malignant transformations of the process resulting in osteosarcoma. Surgical intervention primarily depended on the rate of the progression of the lesion, likelihood of clinical regeneration, the potential for pathological fractures, extent of tissue involved, the emotional state of the patients, severe physiologically disinfection such as respiration, vision, and dilation, psychologically distress due to cirrhosis, disfragment. Thank you.